Welcome to Business Recipe. Every business has a recipe. Here's theirs. Today's recipe, Elevance, formerly known as Anthem, currently posting $5.6 billion in annual profit and maintaining a psychiatrist directory where 93 out of 100 listed doctors don't actually answer the phone. This is the fifth and final recipe from the hospital kitchen. And this one closes the loop on everything we've cooked. The uncomfortable truth is that Elevance's profitability and its denial system are not competing forces. They are the same force. Here's the recipe they've been following. The ingredients: a denial machinery built from prior authorization, medical necessity criteria, and provider directories no one audits. The method: medical loss ratio optimization, the legal mechanism that turns every denied claim into a fraction of a profit margin. The result: $5.6 billion net income in 2025. And who ate it? That's where this recipe gets uncomfortable. In March 2024, a lawyer tested 100 psychiatrists listed in Anthem Blue Cross's in-network directory near Yonkers, New York. 100 names. A network the company promised existed. Out of those 100, exactly 7 yielded an appointment. The other 93 were phantoms, disconnected numbers, providers who had left the network years earlier, doctors whose specialties were mislabeled. One listing had duplicate entries with different phone numbers for the same physician. All wrong. This is documented in federal court filings from the Ghost Network class action against Anthem Health Choice Assurance, tracked by Georgetown University's Healthcare Litigation Tracker. That's the first ingredient in this recipe. A network directory no one is incentivized to maintain, because patients who call wrong numbers don't generate claims. Now meet the company behind the directory. Anthem, Inc., rebranded to Elevance Health on June 27, 2022. About 1,000 employees worked on the transition. The new name combines Elevate and Advance. The denial rates continued on the same trajectory. Today, Elevance covers approximately 118 million people across commercial, Medicaid, and Medicare lines. It posted $197.6 billion in operating revenue in 2025. 1 in 3 Americans is touched by this company's decisions. Here are the 3 core ingredients in Elevance's recipe. Prior authorization. The requirement that doctors obtain insurer permission before treatment. Medical necessity criteria. The internal guidelines that determine what qualifies for coverage. And the provider directory, the map patients use to find care the insurer has promised to cover. These are not administrative overhead. They are the levers. Elevance runs these levers through a subsidiary called Carelon Medical Benefits Management, the second largest prior authorization processing operation in the United States. Carelon manages prior auth for Elevance's own plans and for external clients. The American Medical Association found that 59% of physicians rated Anthem and Elevance prior authorization burden as high or extremely high. The medical loss ratio is the most powerful number in health insurance that almost nobody outside the industry talks about. Here's how it works. Insurers collect premiums. They pay out claims. The MLR is the ratio of claims paid to premiums collected. The Affordable Care Act mandates a minimum of 80% for individual plans, 85% for large group plans. Below 80%, insurers must issue rebates to policyholders. So the floor is set by law. Elevance's blended MLR in 2025 was 93.5%. On its face, that looks like 93 cents of every premium dollar going to patient care. A reasonable person sees that number and thinks, there's not much room for abuse here. But the MLR is an average across all segments: Medicaid, Medicare, and commercial. Medicaid runs at high utilization with lower margins. It pulls the blended rate up. The commercial book, where the profitable policies live, runs differently. And the MLR measures what was paid. It doesn't capture what was denied before a claim could be filed. Now look at what the method actually produced between 2017 and 2025. Anthem applied medical necessity guidelines for mental health residential treatment that courts and regulators later found more restrictive than generally accepted standards of care. 8 years. From April 29, 2017 to April 30, 2025. The class that formed around those denials. Nearly 19,000 people. The settlement Elevance agreed to $12.875 million. That is approximately 678 days per person, for years of denied mental health care. Then there is the Medicare Advantage method. From November 2018 to October 2025, 7 years, Elevance submitted unverified diagnosis codes to the Centers for Medicare and Medicaid Services, unverified codes that suggested members were sicker than their medical records documented. Sicker patients generate higher risk adjustment payments from the government. In February 2026, CMS Director John A. Scott sent Elevance a sanction letter, calling the conduct a, quote, pattern of knowing non-compliance. In Q1 2026, Elevance booked a $935 million accrual to account for what it had to return. The stock dropped more than 8% the day the notice was announced. In 2025, Elevance Health posted $5,062 billion in shareholders' net income. The year before, it returned $4.4 billion to shareholders through dividends and stock buybacks. Consecutive dividend increases, 14 years. Annual dividend per share in 2024, $6.52, up 10.1% from the prior year. On January 22, 2026, Gail Boudreaux, President and CEO of Elevance Health, testified before the House Ways and Means Committee, alongside the CEOs of UnitedHealth, CVS, and Cigna. The executives acknowledged, as a group, that they could be doing more to improve affordability and access. Then they attributed the crisis to hospitals and drug companies. U.S. healthcare spending reached $5.3 trillion in 2024, growing 7.2% year over year, with higher utilization and prescription drug costs as the primary drivers. The insurer in this framing is merely the pipe through which cost flows, not the profit center extracting a margin from the flow. 6 days later, on January 26th, a federal court held a fairness hearing on the $12.75 million mental health settlement. The timeline is not a coincidence. It is the rhythm of this industry. The rebrand itself is worth noting. Anthem became Elevance on June 27, 2022. The company said the new name reflected its commitment to, quote, elevating whole health and advancing health beyond healthcare. The same year, it posted $5.9 billion in net income, its highest to that point. The name changed. The recipe did not. Now, the strongest version of the defense. Because this story has a real counter-argument that deserves to be heard clearly. Counter-argument 1. In 2024, KFF found Elevance's ACA marketplace denial rate dropped to 8%, the lowest among large insurers. The industry average was 19 to 20%. That is not a company maximizing denials. That is a company that improved faster than every peer in a single year. Counterargument 2. The MLR law actually forces payout. At 93.5%, Elevance paid out 93 cents of every premium dollar. The profit margin on $197 billion in revenue is roughly 2.8%. Many industries would call that thin. Here's the rebuttal. The 2023 and 2024 KFF figures cover different plan populations under different reporting requirements. KFF itself notes that insurers do not report what types of services were denied. So 8% denial volume does not tell you whether those denials were for routine lab work or for inpatient psychiatric care. The content of a denial matters as much as its frequency. And the MLR is a blended average that Medicaid's high-cost, high-volume base distorts upward. More precisely, the $935 million Medicare Advantage write-down reflects 7 years of inflating risk scores to collect higher government payments. Not paying out more claims, but collecting more revenue through diagnostic upcoding. That is not MLR compliance. That is a different lever entirely. So the recipe worked. The question is, who had to pay for it? Nearly 19,000 people filed claims in the Anthem mental health settlement. Each had been denied residential treatment for depression, for addiction, for conditions their doctors said required inpatient care. The settlement math, $12,875 million divided by 19,000 people equals roughly $678 each. The same year the settlement was finalized, Elevance returned $4.4 billion to shareholders. That's $231,578 per settlement class member returned to investors in the same calendar year for every person who was denied mental health care. Then there are the ghost network patients. When you need a psychiatrist and call 93 wrong numbers, most people don't call a 94th. They either pay out of pocket, delay care, or give up. The class action complaint documents patients who paid thousands out of pocket after being forced to use out-of-network providers. The directory had told them were covered. Think about what a provider directory is supposed to be. It is a promise. The insurer says, pay your premiums. And when you need care, here are the doctors who will see you. A directory with 93% phantom listings is not a broken promise. It is a promise that was never made in good faith. Now step back to the full picture. This is the 5th recipe from the Hospital Kitchen series. We opened with UnitedHealth's algorithm denying skilled nursing care for a man who had fallen and broken his hip, overriding his physician's recommendation. We looked at Cigna's PXDX system, which processed prior authorization decisions in an average of 1.2 seconds, too fast for a human to read a file. We examined how Epic systems locked up medical records behind infrastructure hospitals can't afford to leave. We traced the prior authorization system that converted doctor-patient decisions into insurer permission requests. And now, Elevance, ghost networks, 8 years of mental health denials, 7 years of Medicare upcoding, and a rebrand that changed the letterhead and nothing else. This is not 5 companies failing. This is one system operating as designed. The design is simple: minimize what flows out as claims. Maximize what comes in as premiums and government payments. Every tool in this recipe, prior authorization, medical necessity criteria, risk score, inflation, ghost networks, serves that design. The 93 phantom psychiatrists were not a data error. They were the product of a directory no one was incentivized to maintain, because patients who dial wrong numbers don't submit claims. Every company in this series left the same fingerprints. Here are 3 signs you are inside this kitchen right now. Sign 1. The directory that no one audits. Before you need care, test your insurer's provider directory. Call 3 listed in-network providers in your specialty. If more than one is wrong, disconnected, not accepting patients, or out of network, you are dealing with a ghost kitchen. The Yonkers survey found 93% failure rate. The industry has no legal deadline to verify listings. Sign 2. The prior authorization that arrives after the window closes. If your insurer requires prior authorization for a time-sensitive procedure and the approval timeline exceeds the clinical window, that is not a processing delay. That is a denial with paperwork. Carelon processes prior auth for millions of patients. The AMA found 59% of physicians rate this burden as high or extremely high. Sign 3. The settlement that costs less than 1/4 of dividends. When a company settles a class action for $12,875 million while returning $4.4 billion to shareholders in the same year, the settlement is not a deterrent. It is a line item. The math does not incentivize change. The recipe is not broken. That is the point. It works exactly as designed, just not for you. This is the 5th and final recipe from the Hospital Kitchen series. 5 weeks, 5 companies, 1 system. What we found every time is the same ingredient: a profit motive optimized until it becomes indistinguishable from a denial motive. If this series changed how you read an explanation of benefits, or how you think about the next prior authorization request, that is the recipe working. Subscribe to Business Recipe if you want to keep reading the fine print. Next week, we leave the hospital and open a different kitchen entirely. Today's recipe? Complete. So, what business should we crack open next? Drop the company name in the comments. We read them. If you want more case studies like this one, subscribe. New recipe every Tuesday.